Hello, this is Dr. Do again. We have finished talking about abdominal pain. I have finished the left upper abdomen, middle upper abdomen, and today we're going to talk about the right upper abdominal pain. If you have the pain on the right upper abdomen, what kind of signs to remind you go to emergency right away? For example, it's during the holiday you eat a large meal and you feel suddenly the right upper abdomen colic pain and associated with nausea, vomiting, and you thought, okay, probably it will go away, and you wait for probably a couple hours. You cannot sit, you cannot lie down. No matter what I do, it's just the pain there. So this indicates that your gallbladder is inflamed. So you need to go to the emergency room right away. So talk about the right upper abdomen. There are three major organs we can think about it. One is the gallbladder we just mentioned, acute cholecystitis or gallstone, lodged at the duct. So the pressure of the gallbladder is rising up, cause the pain, and the liver, okay, and the part of the colon, okay, the right flexure of the colon. From ascending to transverse, there's a corner here to make a turn. It's called the right flexure. Okay, so if that's the case, like I said, the emergency for visiting the emergency room is the cholecystitis or gallstone lodged, block the bile duct, the gallbladder becomes inflamed. In terms of liver, if you have previous existing disease on the liver, for example, liver cancer or some other blood vessel abnormalities, if you feel sudden bursting pain, that means, or you have cyst. The doctor told you had a cyst in your liver, but we're not going to touch it. We're not going to, since it doesn't bother you. Okay, so you know you had it, and suddenly it burst pain. That means the cyst probably broke, and you need to go to see your physician right away. Otherwise, I couldn't think any liver condition caused the acute emergency visit. Or you had an injury, that's a different story. Or if you're falling down on, the mechanical falls blind on your right upper abdomen. So that's the other case you need to see the emergency. In terms of colon, if you have pre-existing condition, for example, your doctor told you have a ulcer or you had tumor and you feel suddenly pain, bursting pain, that means something's bad happening. You need to see your physician right away. So these are the summarized for the emergency situation you need to manage right away. What kind of symptoms you can observe at home? Usually because three of these organs are so important, except for the diarrhea, colitis, you eat some fresh food, you know it, you're not the only one had this, and you can stay at home, replenish with some water, drink, and monitor your temperature, your general body condition. Make sure not dehydrated for a couple, probably 1 day or 2 days. If it doesn't go away, then you still need to see your physician, especially for the colitis, for the diarrhea, nausea, vomiting associated with right upper abdominal pain. So that means the diarrhea could caused by some severe uncommon bacteria. Then you need to see your physician. Okay, having talked about the three regions on the upper, let's move to the lower. The left lower abdomen, the middle lower abdomen, and the right lower abdomen. Let's start from the left. The left lower abdominal pain usually caused by the disease called diverticulitis. What is that? It's the inflamed of diverticulosis. You have some protruding mucus tissue in the wall. So there's the subtle little pit there you do not know. And if in the case you have food falling into that little pit and cause the inflammation, then you feel left lower abdominal pain. Usually, sometimes it's associated with blood. Okay, you may or may not have the bright blood per rectum. Okay, but you may or may not have fever, nausea, vomiting. Again, if this is the case, if your doctor told you, or if you know from the scope, you know you had a diverticuli there, then if you feel the pain, means something you need to see your physician. Even though it's not emergency, you need to call your physician. Probably they will prescribe you some antibiotics to quench the flame, okay, so you'll feel better. All right, that's the major condition I can think for the emergency situation, or for the condition you have to see your physician, not delay, even though it's not emergency, but not delay. Or some other subtle condition like a cancer, you just feel uncomfortable here. This is a common place to have a cancer, be honest. So you just feel uncomfortable. However, the cancer usually present with special symptoms. It's not just pain or emergency or something like that. But if you feel here chronically uncomfortable, then you need to check it out, especially when you're older, or if you have family history for colon cancer or ulcerative disease called inflammatory bowel disease. If you have this history, I'm sure you know it. Your doctor told you what kind of signs you should look for to visit them regularly or go to the emergency room. Okay, and for the left lower abdominal pain for female, and we're going to talk about together, no matter left, middle, or right. For the female, there's probably inflammatory pelvic inflammatory disease or ectopic, and these are the situations we're going to in a special video talk about that. Okay, for the right lower abdomen in general population, of course, the first one we think about is the appendicitis. We already talked about that. Could be pain. It's called the pain start from the middle of abdomen, move down to the right lower abdomen, associated with nausea, vomiting, may or may not have fever. And if that's the case, if you feel really sick, you're sweating, that means you need to see your physician, go to the emergency. Or you have this kind of dull pain. It's not a 1 day, 2 day, has been going for a while. It could be, if you're female, like I said, it could be the other causes. But if you're anyway, if you have it in the right lower abdominal pain, see your physician to discuss, especially for those lasting long time. Okay, I'll see you next time.